Hi everyone, we're Clara. First, I want to present a situation that many of you can relate to. You've been in school for at this point 3 presidential terms, and you get out and you finally do what you're trained to do, to be a doctor and help people, especially women who've been told for years that their pains are just hormonal. You listen, you diagnose, and you document, and you order the imaging that she needs. She may need a breast MRI, an ultrasound, maybe even a follow-up mammogram. And that's exactly where the medicine ends and the documentation begins. Her claim becomes endless paperwork and a game of hot potato between insurer, clinic, and the void, until the system decides that her claim is denied. Somebody who hasn't even met her claims that it's denied. It's 2025. Cars can drive themselves, and patients can somehow diagnose themselves with WebMD. But somehow, we still can't get women the imaging they need desperately to survive. That's why we built Clara, an AI that bridges the gap between healthcare insurers and doctors in order to make women's imaging faster, fairer, and more human.
As we were saying earlier, we're looking to remove the hot potato phenomenon by implementing an AI model. We're going to make sure that the AI model helps approve the claims faster so that they don't get denied.
Okay. Hi, I'm going to be introducing the architecture. So the input will be the form data. So that's what the Women's Health Clinic is submitting. And then we have LLM1 that is taking all the fields the health clinic has submitted and generating a patient summary. LLM2, which is checking all the fields and making sure that they make sense. And LLM3, which is looking at the ICD and the CPT. These are diagnosis and procedure codes, and it's making sure that both of them link and make sense. Finally, we have LM4 that is taking the outputs of all of them and making sense of it. It's creating 3 outputs: confidence scores, summary, and decision. And all of those are routed to our output that determines what the insurance side ends up seeing. So that's our architecture.
Hi, I'm Elvira, and I'm going to be walking through a demo of Clara today. So first, you can see that we have 2 ways to log in, either through the clinics method or the insurance method. First, let's look at clinics. Just going to log in. And we can see our dashboard, which has our case distribution, our estimated revenue saved, cumulative savings, and our recent requests. And we see that we have 2 pending requests right now. Our first request is about a 47-year-old woman, and we can see that she's missing some information she's supposed to have, the ICD code and the CPT code. So her claim should be rejected. We also see another case here of a 62-year-old woman, and we see that she has all the information she's supposed to have, and assuming that all that information is correct, then this claim should be approved. Now let's check our AI. You can see here that this claim here corresponds to the 47-year-old woman, and we're checking through the ICD, does everything match, is everything correct, and we see that it does not for some whatever reason, and it fails. Now we have the other one. We see that everything, all the checks that we're supposed to complete, they pass, and so there's a pass. Now what we can do is we can act as the insurer and log in through insurance. And we see that we have these 2 cases, the same cases, pending for review. We'll click one. We see this AI analysis tab that tells us the same decision that we saw. We see that it's failing for that 47-year-old woman, and we can mark it as reject, as we agree with this AI analysis. So now it's marked as rejected. Now we have this claim. We can see the AI analysis again here. We agree with it. This is a passing claim, and so we can mark it as approve. And so there are our 2 cases. Now we can go back to the clinic view, and we see, if we reload our page, that, wow, our case distribution is updated, our estimated revenue is updated, and our cumulative savings is updated to reflect the approval and rejection. And we can see that here as well. So as we can see, we've updated our revenue saved and our success rate as well. So that's our demo.